Law enforcement agencies across the state are carrying Narcan in their patrol cars.
23 ABC's Daniela Garrido gives us a look at the training that's behind the drug that's saving lives on a regular basis. Good morning, Daniela.
That's right. California's Narcan grant program was approved in 2016 and has set aside $3 million to distribute the reversal drug to various counties. Less than 5 years ago, it was only in the hands of EMTs or select officers. In the past couple of years, though, there's been a push for law enforcement to be trained and equipped with the drug.
As the opioid epidemic continues to claim lives across the country, more members of law enforcement are armed with naloxone, also known as Narcan.
We're saving numerous lives throughout California now with our deputies.
Narcan is known as a reversal drug for someone undergoing an opioid overdose. In 2015, the FDA approved a nasal spray version of Narcan, which made the drug easier to carry. The nasal spray is given when a patient's respiratory rate is less than 8, blocking the opioid from making it to parts of the brain. The drug is then able to help the patient slowly start to breathe again. According to the California Department of Public Health, the amount of opioid overdose deaths nearly tripled between 2015 and 2017. KCSO says they began training in 2015.
There were 3 departments that had already started deploying Narcan in California, and we became the 4th agency in California to deploy Narcan with their agency. So Kern County Sheriff, again, being the 3rd largest county in California, what an opportunity.
KCSO says 3 years ago, the first round of Narcan training was selective.
They selected a few deputies, FTO officers, senior officers throughout the county, through our substations and metro. About 30 or so went through the initial training.
Today, all 309 deputies carry the drug.
We've had 7 saves since the deployment, and that's huge. That would have been 7 people that maybe won't be here. They wouldn't have been here without the deputies and having Narcan on hand.
Go ahead and pop our caps, insert our 2 milligrams of Narcan. Get my atomizer, which will be inserted.
23 ABC got a look at the training deputies undergo to administer the drug, which can be performed in less than 3 minutes.
Rapidly squeeze the nostril here, give 1 ml here, squeeze the other nostril, give 1 more ml, which is really 1 milligram of Narcan.
But the decision whether law enforcement should or shouldn't carry the drug is different in every agency across the country.
You're acting like you're a medical person. They're not EMTs, they're not paramedics, they're deputies.
In a statement, Bakersfield Police Department said they do not currently have a policy in place to train officers to use Narcan. However, Bakersfield Fire Department does carry Narcan.
Yeah, I think it comes down to response times. Here within the metropolitan area, we're either simultaneously or one on top of another responding to calls and arriving to calls. So we're able to handle that medical side of it, and BPD, we work together with them as a team. They handle the safety side of it. So
BFD also added it's important as first responders to have the drug on hand since they never know what they're going to encounter in a call.
Any incident that we respond to, we want to be able to quickly and efficiently mitigate any problems that we come across.
It was only 3 months ago that these qualified organizations and entities, which include law enforcement, schools, and veteran organizations, were able to request free Narcan from the California Department of Healthcare Services. The push is funded by the Substance Abuse and Mental Health Services Administration and is a way to combat opioid overdoses throughout the state.